even when the child is giving birth to, at the first day of life, the children are vaccinated against TB. They are given a vaccine which we call BCG vaccine. And that anywhere in Nigeria, that is the first vaccine that you give a child, and that is to prevent tuberculosis infection, because the child can come with somebody that is affected with TB, because TB is a disease that affects maybe 1/3 of the world. That affects 1/3 of the world, and in fact we have people now coming with active infection. About 8.8 million people have said to be having the active infection. Even in Nigeria, TB is a disease of high disease morbidity and mortality. That means because it's death. And even by the time we finish this program now, it said every 8 seconds in Nigeria, maybe 8 people have died of TB.
Wow.
So you can see how serious the infection is. So it affects children, it affects even the elderly people, and it affects all age groups. No one is exempted. But for children, we want to prevent them from having. That's why we give them vaccine at the first day of life.
So it is wrong to say that, because some will just tell you that when you talk about tuberculosis, TB, it affects majorly those that smoke. So it is wrong to say that. Some believe that if you are a smoker, that is your disease. That is a disease that you just have to face.
Yes, another maybe you just brought me into remembrance too. A risk factor to also having TB. People that smokes, people that take alcohol, because all the people that abuse drugs, substance abuse, because it also lowers their immunity, so they are prone to infection. So that is why smokers too are liable to have TB.
If you do not know, I'll remind you that we partner with Ikorodu General Hospital to talk about health matters. And today we focus on tuberculosis. Do not forget that World TB Day for 2022 is set aside every 24th of March. This year was not an exception, and it was actually a very, very good day to orientate the general public, which General Hospital also did so well. With me in the studio, I still have the Chief Nursing Officer, CNO of General Hospital, no other than Stella, Adio, and of course, Dr. Yetunde Odusolu, who has been doing justice to the conversation already. And yes, by my left-hand side, my brother from another mother, the Coach Officer and TB Survivor, Asoro, Abubakri, Olatunji. So, still going ahead of this conversation, Doctor, when we talk about tuberculosis, it is no longer news.
Yeah.
People are aware that there is tuberculosis, but yet we have very few persons who take cognizance of it. We have very few persons who take it serious and maybe just TB. So far, me, I don't smoke. So far, I don't drink. So far, I don't stay in an environment that is unclean and all of that. How does tuberculosis spread?
Well, tuberculosis spread through airborne infection, through air droplets, through the air. And he said that when somebody coughs, when the person sneezes, when the person sings, when the person laughs, anything that makes the person to open the mouth wide, and the droplets will come out of the mouth. So all those things, like I'm talking now, I can be releasing droplets into the air. So
no, I know I'm safe with you.
Yeah, supposing I have TB, then the bacteria are released into the air, and they are suspended for hours inside the air. So if you walk into that kind of environment and the person, somebody inhales the bacteria, and the person's immunity is, so to say, it may be depressed, person can have the TB, manifesting, going through the chain of reaction into the body, and person manifests with TB.
There are some major symptoms of tuberculosis.
Yes.
That some people are not aware of.
Yes.
You would agree with me with that. So I would like us to take the symptoms one after the other with very good explanation so that people can be aware. Do not forget that I'll open the phone lines when it is time for us to take in the calls on 0904-081-1061. At the same time, we are live on Facebook and Instagram at IKD1061FM, and you can hear us all over the world via our website www.ikd1061fm.ng. We are still here with Ikorodu General Hospital. Our focus today is tuberculosis. So let's talk about the symptoms of tuberculosis.
TB, we say we have two types, because let me just educate properly. We have the pulmonary TB and the extrapulmonary TB. When you say pulmonary TB, it affects majorly the lungs, and this is what, it may be in 75 to 80% of cases of when we have TB infection. Then we have the extrapulmonary TB. This one's TB that affects other parts of the body. That means the bacteria goes into is disseminated to other parts of the body, and it can affect any part of the body. It can affect the brain, it can affect the bones, it can affect the liver, it can affect the kidney, it can affect the ovaries, it can affect the abdomen, it can affect every part of the body. So if it affects any part of the body and it starts its reaction, the person can manifest symptoms of disease of that particular area in the body. But not much ado about that. When we're talking about pulmonary TB, the person has been someone that has been coughing with no respite, coughing lasting for more than 2 to 3 weeks. The person has fought a bad cough that the person has been, even sometimes the cough is usually worse at night, and the person will just be coughing and be taking so many drugs maybe, and there is no respite, the cough is not going. The person should go and get himself checked and tested for TB. Then aside cough, the person may also be coughing or sputum and phlegm that is stained with blood. Sometimes some people will just cough frank blood. Wow. Depending on how advanced the infection is. Also, the person will manifest with weight loss. Person with TB has weight loss. They have loss of appetite. They are not eating well. Of course, they will have weight loss. They also have what we call night sweat. They will be sweating at night, despite maybe the environment being cool and airy. They will be sweating profusely, excessive night sweat. The person has TB. Also, they have what we call intermittent fever, low-grade fever. They just be having fever that is coming and going. Some of them, they manifest with chest pain. Because they are coughing, they manifest with chest pain. Some, they may have what we call breathlessness. They will not be able to breathe well. Yes. Some will also have malaise, fatigue, general feeling of unwell. And of course, we may ask the person may have an history of contact with somebody that has been coughing before. That means because TB spread easily. If somebody with RT-TB, you come in contact with somebody with RT-TB and you stay in the air with that person, it's likely you inhale the person, and that thereby TB spreads easily. Yeah.
All right. Thank you so very much, Dr. Yetunde. We'll look at the treatment to tuberculosis, because I know there are a lot of people who would want to ask one or two questions about tuberculosis, and that is what will bring me down to you, Chief Nursing Officer, CNO, Stella Adio. I want to believe that tuberculosis, first of the question is tuberculosis curable?
Yes, it's curable.
It's curable. Very well then. So let's look at the treatment.
Treatment is treatable, curable, and preventable.
Okay.
The treatment is divided into two lines. We have the first line, which is drug susceptible tuberculosis, and the second line is multi-drug resistant tuberculosis. The first line consists of intensive and continuation phase. The intensive phase is for 2 months, while the continuation phase is for 4 months. Altogether is 6 months, which is the pulmonary tuberculosis. And the first intensive phase consists of the combination drugs, which are etabutor, parazinamide, isoniazid, and rifampicin. The continuation phase for 4 months, that one consists of rifampicin and isoniazid, which is for 6 months. Along the line, when the patient is taking the drug, we carry out a lot of tests, like the sputum tests, which we confirm that if the patient is cured or not. And the tests carry out for at least a month, a week before end of 2 months, a week before end of 5th month, a week before end of 6 months. After 6 months, if the patient is being carry out the test and the test give us negative, that means the patient is cured. But at the end of 6 months, if the test results come positive, that means patient's treatment fail. We recommend.
Okay, so treatment could even fail.
Yes. Wow. Along the treatment.
Wow. Okay.
Along the treatment, and we have the multi-drug resistance, resistant to at least both rifampicin and isoniazid. That case is multi-drug resistant. That drug is for 9 months and it's shorter regimen. The drug, it consists of 7 drugs, which are the moxifloxacin, clofazimine, parazinamide, etabutor, high dose of isoniazid, protonamide, pyridoxine, and bedaquiline. This drug work a lot. They work a lot. The intensive phase for the pulmonary tuberculosis, we have categories. The intensive phase for pulmonary tuberculosis, which is the regimen 2. The regimen 2 is for the regimen 2 tuberculosis is for those people that have extrapulmonary tuberculosis. the extrapulmonary tuberculosis is the virus affect the organs like the spine.
Okay.
Yes, spine. The spine, the kidney, the liver, and etc. The spine, the person will be on treatment for 12 months.
Wow.
12 months, yes. The intensive phase will be 2 months, while the continuation phase will be 10 months. Altogether will be 1 year treatment.
Wow.
At the end of the day, we also, with the aim of treatment is that to prevent the transmission of this tuberculosis, to prevent the death, and to prevent relapse of tuberculosis in the community.
All right. Thank you so very much. Normally, I like to pen down some things, but right now I'm so lost. I did not even know which to pen down. If you have all that in your head, then I will say well done with all that names. So you we are still on the issues anyway, and today we focus on tuberculosis. I'll come down to you, Dr. Yetunde, because I think you will not give me too much of a headache with with all those names. Earlier, you said there are 2 major types of tuberculosis. Now, these 2 major types, are there stages? I think that there's a difference between the types of tuberculosis and the stages. So, can we just talk a little bit about the stages before we switch over to our cough officer?
Yeah, we have 3 main stages of TB infection.
3?
Yeah, we have the primary infection. That is when a person inhales the bacterium into the lungs, and the reaction starts, the process starts. So when it gets into the lungs, the second stage starts, where we call the late. Sometimes the body's immune system will be able to fight off that primary infection, so the person will not have anything in the body. Okay. But if it goes on to the second stage, which we call the latent stage. That means the bacteria is now hiding or sleeping inside the person's lungs.
Comfortably.
Yes. So when a period of maybe there is depression or depression of the immune system, the bacteria can be reawakened. They call it reactivation. So it is now starts some reaction in the body, which lead to the 3rd stage, which we call the active phase, where the bacteria are now multiplying, and that the person now manifests with symptoms, so that even when the person coughs, the person releases the bacteria into the air. So we have the primary stage, the latent stage, and the active phase of the TB.
All right, those are the 3 stages of TB.
Yeah.
But at the first stage, it's still very fair.
Yeah.
Same as the second stage. But when you talk about this 3rd stage, that one looks more scary.
Yeah.
At that point, is it still curable, or by then it's too late?
No, it's still curable. That is even to those people in the active phase that usually pick that you talk about, they will be having symptoms, that they will be coughing, they will be having fever, night sweat, weight loss, and those are the ones that are active. And when they cough, some people have TB in the body and they are not coughing. That's the latent phase. It's just inside their body like that. But the active phase are people that will manifest the symptoms.
Physically.
And those are the ones that, okay, it's curable. Even the latent phase is also curable if we don't want somebody to progress to the active phase.
Okay, somebody said something one time that it's possible to have tuberculosis. And when you talk about the stages, that's why I want to ask this question. Maybe the first stage or the second stage, and if you just believe, this is not about even religion now, it has not gotten worse. Can tuberculosis at any of these stages cure itself and just disappear, either the first stage or the second stage?
It cannot disappear.
If it's there,
it's there, it's there. The bacteria is there. It cannot disappear.
Oh, okay.
Yes. You need to treat it, because some of us may even have the bacteria hidden dormant in our body.
Wow.
Yes. But so that's why we advise people to eat healthy living, healthy eating, healthy environment. Don't live in a crowded environment. Make sure there's good ventilation, so that you are not prone to having TB.
Okay. The most common of all is if someone is a smoker. I asked that earlier. I still want us to emphasize on that. Those that smoke and those that drink, those are the most common people that they say they are liable to be infected with this tuberculosis. Aside smoking and drinking, what other thing should we be aware of?
There are some things that you can help. There are some things you cannot help. Somebody that has HIV now, they are prone to. It has been said that even 20 HIV people are prone to having the TB 22 times more than people that don't have HIV.
Wow.
Yes.
Wow.
Somebody that has diabetes mellitus, a disease, they are 2 to 3 times.
Immunosuppression.
They are 2 to 3
You
times.
have started again with.
People that have diabetes mellitus, they are more 2 to 3 times more likely to have the infection, and all this because their immunity is suppressed. You know, they are reduced immunity. Then also people that have maybe cancer, also the same thing works with them because they are immunosuppressed. People that are poverty stricken, you know, homeless people,
that.
yes. So they have the risk of having TB.
All right, so let me come to you, Asoro Abubakri. I told our listeners out there, if you're hearing us, I told you that we have a TB survivor in the house, and I think all of this is not strange to you. All of these botanical names or whatever it is, is not strange to you. So let me come down to you. From all of these types of tuberculosis, which was actually yours?
Okay, mine was pulmonary TB. Like the doctor said, the one that affects the lungs.
Okay.
That was mine. And I also followed the same treatment process. I took the treatment for 6 months.
6 months?
Yes, 6 months.
What year was that?
I survived in 2018. I got it
Wow.
late December 2017.
Okay.
So I completed my treatment in 2018. So basically, I took the drug for 6 months. I was also doing the test like she has said. And one major thing that she also said, and when she was talking about maybe someone can be positive at the end of the whole treatment. We used to have cases when, you know, the natural tradition of our people here in Africa is that when you start taking drug and you are getting better, you just believe that you are okay. You're not taking. So those are the cases where we have people now relapsing, where at the end of the treatment, they now become positive again. Because according to the treatment, you have to take it every day. You must not miss it.
Every day?
Every day.
Wow.
You must not miss it for a single day.
Wow.
So where we now have people who default, we used to have defaulters. And they felt that because they are okay for 1 month, they have taken it, they started throwing it somewhere, they forgot about it.
Some will go to church and say hallelujah.
Hallelujah. So, no, of course, we used to have cases like that. And we have had cases, and it happened to me too. When I got down with the disease, you know, despite how enlightened I was, I only know TB. I could not believe that it can come down with someone like me, you know. So, but in the process, I was having an election. I am a student activist, of course. So I was having some election in the school, and it was top period. Someone was threatening to use the Adio against me. So when I came down with this, I was like,
this is Adio.
And the spell has come down. The spell has really become. So I was thinking it is something like that until. Thank God for one of my uncle who insisted that I have to go to the hospital. And that is why we are telling our people. Most of our people, when they got down, they used to think it is spell, it is spiritual attack. The thing they do is to go to the mosque, to go to the church and seek for
spiritual help.
But when they get there, they also send it. They also spread it to the pastor. They spread it to every member. So every member of the church. So when you first get down with this, the first thing you should do is to report to a public health facility. At General Hospital in Ikorodu, for example, we have many facilities which are even free, where we can get people tested. Even the treatment is also free.
Wow.
So, and that was what people like us benefited. I am aware that most of those.
So you're saying that you benefited from free treatment of tuberculosis?
Yes, the treatment was completely, even the test from from the test to the treatment, everything is completely free. In fact, these days they have also added some other facilities to ensure that nobody escapes. Because, like doctors say, for example, if what you have is we have some different tests like the gene expert. The gene experts in some cases, if you have been taking antibiotics, it may not discover it. But these days we have another machine, an X-ray machine, which we use to confirm. So no matter how hidden it is, especially except if it is extra pulmonary, the doctor and other people may want to do other recommendation, test recommendation. But in as much as it is pulmonary, when you do the gene expert, you did not discover it. The X-ray will surely discover it.
You can't escape from that
cannot
one.
escape it. So
okay, we'll take in just a very few calls because of our time. 0904-081-1061. I'm still coming down to you because you have to share a little bit of your experience during that time. How was it like for you while you battled with tuberculosis?
Well, it was well. I would say that as that because at a point I was seeing that.
Wow.
I was seeing that, and while I was trying to seek spiritual solution, But I thank God for that my particular uncle that asked me to still go back to, and that was it. One of those challenges that we used to basically have is the issue of discrimination.
Okay.
I used to tell people, if you want to, immediately I got this disease, I did not always hesitate to educate people and to let people know that I have it.
Wow.
Because most time, our society, there's a way we frown at people who go down with all of this. And most of the challenges that we used to have with some of the patients that even come to clinic is that they will say that their employer got them sacked and all that. So I think that doctor will also have to confirm that when you start taking this drug for some period of time, you may no longer be able to, infect other people. So the discrimination at workplace is another thing. Like my brother, the caller have said, one of those things that you have to do is to eat well and use the medicine. The two work for so you'll be very strong. But one other thing that people have to work towards, while we fight this disease, we must ensure so that we focus the fight on the disease, not the people that are down with the disease. Because when they are also emotionally down,
yes,
emotional trauma can also it even kills more than the disease itself.
Yes, please. That's true.
So that's one other thing. We don't want people to discriminate against them. What they need at that point is love, care, and also ensure that you also monitor them and ensure that they use that drug. They will be very fine. They will even be fine than those that were even discriminated.
That are free from tuberculosis.
Yes.
Time is fast spent. Let me come back to you, Stella, Adio. When we talk about tuberculosis, how has the response been? You have attended to so many persons that are infected with tuberculosis. How has the response been from all of your patients? Quickly.
The response is that the way I see my patients, anytime they come to the facility,
yes,
I always happy. Some will down before coming for the treatment. At the end of the treatment, they'll be okay. They'll be thanking God.
Wow.
But my own advice to the community is that how to prevent this tuberculosis in the community, that people should make use of these masks very well, properly, and they should avoid splitting around the environment. Make sure that you maintain your personal hygiene and make sure you keep washing hands. Anytime you go out, come in, wash your hands. Thank you, sir.
All right. Thank you so very much. Before we leave the studio, it is still going to be very, very appropriate for me to come back to you, Dr. Yetunde. Your medical advice to everyone out there listening to you. I know there are one or two persons that are out there battling with tuberculosis, but sometimes we have this, just like he said, we have this discrimination, we have this low self-esteem to come out to say that this is what I am battling with, and so many people are dying. Statistics shows that a lot of people die every day due to tuberculosis. What is your word of advice as a doctor?
Well, my word of advice as a doctor to people is that they should, once they are coughing and the cough is lasting more than 2 weeks, they should get tested and they should get treated, because the treatment is free. And also for the people that are in the community, they should support anyone that has TB. TB is a disease that has been colloquially stigmatized. Once you have TB, they stigmatize you.
Exactly.
So we should remove the stigma and let people come out, so that they can get treated. When some people say, yeah, TB, God forbid, I will not have TB. They were past that. Even rich people can have TB. Poor can have TB.
Wow.
So it is not a...
It's not a disease for the poor.
Though they say poverty can be a high risk factor, but it does not mean that a rich person cannot have TB. If you are in an environment, in an airplane now with somebody that has TB and you inhale it, and maybe through stress you are not even eating well, you too can have TB. So don't let us discriminate against anybody that has TB. Let us encourage them. Once somebody is coughing, manifesting all those symptoms that we mentioned about, they should get tested and treated promptly to prevent multi-drug resistant TB and extensive drug resistant TB. All those resistance, because the bacteria can, when they take treatment for 1 or 2 weeks, the bacteria can, and they stop, they can be a resistance to the drugs.
Yeah.
That's why we have MDR TB.
Okay, let's see if we can take just this
treatment.
one call because of our time, so we can leave. Hello.
Good afternoon.
Good afternoon. Your name and where you're calling us from? Real quick.
I'm Mr. Lesh. I'm speaking from Ikorodu.
Okay, your name quickly. Your question or contribution, sorry.
Okay.
Yes.
I want to ask the doctor.
Yes.
Whether that disease is hereditary or communicable.
All right. Okay, thank you. She will attend to that. Okay, let's attend to that. We have just 1 minute to leave.
Disease is not a disease that you can inherit. It is communicable. So if somebody has it in the family and is coughing, everybody living together in the house, you can spread it. But it's not hereditary. Hereditary means that it's genetic, that you can be through genes. It's not inherited through genes. It is through air droplets. And when people live together in the same environment or in the same house, they get the disease.
All right, I would say thank you so very much. This is how much we can take today on the issues where we talk about tuberculosis. Thank you to you, the Chief Nursing Officer, Stella Adio. Thank you for coming. Thank you, Dr. Yetunde Odusolu, who happens to be consultant public health physician. And of course, to my friend and brother, Asoro Abubakri Olatunji, cough officer and TB survivor. My name still remains the same, Adebambo Opayemi. Tomorrow is another very beautiful day. God bless Nigeria. God bless Lagos. And of course, God bless the beautiful people here in Ikorodu. It's a bye for now.